Susan is a mom of 3 in her late 30s. Since a few months after her last child was born, she's experienced accidental urinary leakage, or urinary incontinence. Even though it's had a negative impact on her life, Susan has been too embarrassed to mention it to her friends, family, or even her healthcare provider. What Susan is experiencing is a common pelvic floor disorder, and there are options available to improve her quality of life. The pelvic floor is a group of muscles and connective tissues at the bottom of the pelvis that support the uterus, bladder, and bowels. When these muscles become weak or injured over time, urinary leakage, stool leakage, and vaginal bulging can occur. Nationally, 24% of women report experiencing symptoms of one or more pelvic floor disorders over their lifetime. Urogynecologists at University of Utah Health are the largest group of doctors in the Mountain West to receive specialized training in pelvic floor disorders. They offer expert care for incontinence, bladder, and pelvic floor disorders during any phase in a woman's life. We pride ourselves in providing a safe and welcoming space to discuss sensitive topics with empathy and respect. On your initial visit, we'll evaluate your pelvic floor symptoms, urinary, bowel, pelvic pressure, and/or any vaginal bulging. A physical exam will include an abdominal and pelvic exam to assess your pelvic floor support and muscle health, and may also involve a rectal exam, depending on your symptoms. In addition, there may be some bladder and urine testing done during your visit. We will provide you with treatment options, which may include lifestyle changes, non-surgical treatment, minimally invasive procedures, or more complex surgical procedures. We also offer referrals for pelvic floor physical therapy and other specialty care to help you improve your quality of life. Susan decided to have surgery for her urine leakage and is now back to chasing around her kids without the fear of leaking. Call University of Utah Health today at 801-213-2995 to make an appointment with a urogynecologist and explore your care options.